environmental cleaning schedule on Smart Dentist has been massively updated in the last couple of days. You can see the date, October 21st, largely in response to the case in Victoria where we've got a lot of COVID cases, so dental practices are entering the unfortunate circumstance of being subject to a workplace COVID case and the confusion around that. So your environmental cleaning schedule on Smart Dentist should be a priority before that happens, to get this up to date and to understand what the situation is. So if you have already got an environmental cleaning schedule that you love, you can leave it, but you might like to otherwise start again. So in Smart Dentist or anywhere, an essential part of your cleaning schedule is it will revolve around cleaning one location. So in Smart Dentist you can add locations. So there's a series of locations already in here. Adding locations is really easy. Click the button, write something down. Don't change them or delete them, because anything that's already there will be lost in the never never of computer problems. The other part of your environmental cleaning schedule is handy to have your chemicals listed. So basically it will be your detergent and disinfectant will be the things that we tend to have. So if you go into your register of hazardous chemicals and every chemical happens to be hazardous, please make sure you have your detergent and disinfectant put in there, or if you use a combined one, whatever you use. If you haven't got this set up at all, try the examples, because there's like lots of different safety data sheets that you can find, and you can easily actually go in and edit it once you're in there. So it's the brand name, where it's located, the link to the safety data sheet. It's a lot better putting a link in than putting a file, because they go out of date quite quickly. You're supposed to know when the expiry date is, the quantity you've got stock and anything, and put in here the location. You can link it to a policy. So if you've got a cleaning policy, that would be good. So back to the environmental cleaning schedule. Now you can just add items in here, what should be cleaned, where it's located, the cleaning zone, the risk in of blood. So you've got a low, medium and high risk. This is the pre-COVID things that were risky. Nobody cares anymore. Now the COVID thing is whether it's high touched or infrequently touched. That's what I put down, high or low touched. Different states use different terminology. And then there's the low risk time, what you're going to clean when there's not really a COVID risk. Medium risk, this is for Victorians, lockdown time, and you would naturally use disinfectant for most things. And then COVID, what you might be doing for a single time COVID thing. That would take a lot of time though. Let's use my examples. So I put down a whole lot of generic things. So for instance, we're going to say, let's make our receptionist responsible for cleaning the waiting room. There, receptionist DAs, they'll love that. We've got an alcohol-based hand rub dispenser. Everybody has one now. Air exchange. Now put down air exchange because there is some controversy as to whether you can get away with more if they'll let you off if you can show you do air exchange in the room. So they might not lock you down for so long. We don't really know. What else have we got in the... Then we have cupboards and drawers. We don't really, we've got a table in there. We don't have a dental chair. We don't have a desktop. We have door handles. And we have entry and exit doors. Surfaces. I might just put that one down. We've got door locks. We've also got low use doors on the other side. We've got low touch door surrounds. We don't have any, well, strangely the doors are tucked in, they're sliding doors. I think we'll leave that. We have carpet in our waiting room, bad us. What else have I got? Keyboards, light switches. We've got low use light switches because no one ever turns them on and off. We don't have phones are photo. I put down photo because if you want to keep your cleaning record in such a state that you can show it to someone later on with photos, you should take a photo once a day. I might explain that better later. We've got seats with and bus. We've got a shelf. We do have a shelf. Skirting boards. We don't have tabletops. We don't have toilets. And we have low touch walls and low touch windowsills. So you go save. And look, we've got a cleaning schedule already designed by Glenda. You can disagree. There is all care, no responsibility in the choices. So if you want to change this, and it's all coded, and the code is up here. So the alcohol dispenser, I've put down that you're going to clean it twice a day in a non-COVID time with detergent. Really, probably you're not going to have one in a non-COVID time, but anyway, you're going to, in a COVID time, you're going to clean it twice a day with disinfectant, and if you had to do a deep clean, you're going to disinfect it as well. The air exchange E is, let's have a look what E stands for. Oh, I haven't got this. E is everyday use. Door handles daily, door handles low use weekly, locks and whatever daily or twice a day in COVID time. So on it goes. So once you get it in there, you can just then change the individual things. And so you would build one of those for each location. And then for each location, you can print out a cleaning log. So it'll let you print whatever is relevant for that room. So you can stick it on the wall with its little code, so E is for each use there, and get the staff to sign off an initial. So this is twice a day, so they would need to write the time in there and initial it. And if they took a photo, which they might do at the end of the day, then if you get caught with a COVID case, and you can just take it on your mobile phone, but it has to show the place really cleaned out, nothing on anything. And you might be able to use that as your evidence if you had a COVID case in. So the other thing with this cleaning schedule, really the new thing, is cleaning method that is linked in. So for each of these descriptors, detergent, blah, 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 each of the descriptors, there's an opportunity to write in here how they're used. And you can stick it up in your staff room or get the cleaners to look at it. So it allows you to print that off and supply it as how you use without printing off a million policies. It's like a policy. So there will be a default one in your system when you go in, and you just click edit and you can take that and make it your own. Now for some things here with cleaning, so one of the things the government would like you, the health departments would like you to have, is make sure that people cleaning have training. And we all know we do that all the time, but they have never been in a dental surgery and they have absolutely no idea. So our dental assistants are trained with RTO certification qualifications and should have current PPE training, which they can tick off in Smart Dentist, and you can have a record of infection control prevention. There's a good little YouTube video on cross-infection basics done by Dr. Tiff. Thank you very much. And down here in the cleaning, this description comes out of the Victorian Health Department's guidelines for infection control. So it's very, very good piece of information, but it tells you how to wipe something that's a high touch, high risk area. And in here, you can link it to a competency, so you can assess your staff as being competent at doing it. But you can also get them to do training, because I found a YouTube video that shows exactly how to fold these bits and wipe them. Fantastic. Under detergent and disinfectant, I've got my own training on neutral detergents, disinfectants or barriers, and I thought the correct use of PPE would be essential. So back to your environmental cleaning schedule. So If you needed to do a deep clean, if you've got this set up already, when you need to do a deep clean, which is unlikely to happen, but you've got it there and you can supply it to your cleaner or get your staff doing it. I would get my staff doing it. But anyway, you can supply it to your cleaner and you can make sure, for instance, that you have that the fridge shouldn't be cleaned out. So that is one of the options. I'm going to put a fridge into the waiting room. Let me go to my example. It's just quicker to pick the one I had. So put it in the waiting room. Anyway, let's check. Pretend we don't want them to clean the alcohol-based hand rub. Under the COVID clean, we can pick do not clean. Do not clean. Deep cleaning, do not clean. Because one of the practices, dental practices, that had to have a deep, was under the impression he had to have a deep clean, got someone in and they cleaned out his stuff, his valuable dental equipment, materials that he kept in the fridge. How annoying is that? So when do we need to do a deep clean? This will tell you a bit more of what's going on. So the Victorian government has COVID cleaning guidelines for workplaces, which a lot of this is being based on. It's actually a really good document. Go into the risk matrix if you are a Victorian practice and have a look at this. But for deep cleaning, you have to look at current rules. This takes you to the Victorian government site with the current rules on what to do if you have a positive case in the workplace. Number one, determine when the infectious case was on site. This is information given to me by someone who has dealt with this not in dental care but in other things. If contacted by a patient telling you they are a COVID positive person, require evidence of this. You do not want to be going through this process only to be told that they'd made a mistake or they weren't actually there on the dates. It doesn't line up. So you need to know what date they were tested, and you also need to know when their symptoms started, because the infectious period is 48 or 2 calendar days before the symptoms start, or if there's no symptoms, 48 or 2 calendar days before they were tested. That is the current thing. Current here may change anytime. Then you can use the matrix below to tell you whether the Victorian guidelines are suggesting you need a clean at all. So if you look down here, most of the time you're not going to know until 72 hours after they've been in, and your present additional cleaning and routine cleaning is what is needed to happen. But you still will require to fill in this certificate of completion template. And it requires you to say what you use, to have photos of, here you go, I've got it here, photos of the cleaning products you use, and you need photos of the completed cleaning. So you really should look at now, before you need to do it, make sure you've got your cleaning schedules up to date, and perhaps look at getting staff to sign off that they're doing the cleaning, because you can produce the log of this as evidence and put it forward. So there's quite a complex thing, but I'd just like to point out that when you're being contacted by someone about a positive case, so if the department contacts you, the person doing it will not necessarily have the time to think about your practice. So you actually have to determine where the risk places in. You're required to put in a risk matrix saying what's going on. It's really important that you're up to date and you understand what's going on, because if, for instance, you were told, like one practice was, that they were closing for 14 days, really you would never get a deep clean. Do not pay for it. Anyway, if you do decide to get an external cleaner on, everybody has said they're really unhappy with the quality, but you need to find someone who is not being isolated for 14 days to go in and watch what they're doing. That would be my advice. Anyway, if you are doing a deep clean, or an additional clean, and you have to provide the certificate of completion, I would print out. And we'll get that going. Print out this risk matrix, which won't include this, so you can quote back their own information to them. And I will try and keep this up to date with what's going on for all our practices. So, environmental cleaning schedule. My recommendation is you go through and do it now, so you've got each room's before you actually need to have it, because you are supposed to have it anyway as part of your standard precautions. Let's hope we all stay safe.